Today's topic is sensitivity, specificity, and the ROC curve. Let's start with a simple truth. No medical test is perfect. Sometimes, a test says you're sick when you're not. That's a false positive. And sometimes, it says you're healthy when you're actually sick. That's a false negative. To understand these errors, and how well a test performs overall, imagine a 2x2 table. On one side, we have the true condition, disease present or absent. On the other, we have the test result, positive or negative. This gives us 4 possibilities. 1. True positive. The test correctly says you're sick. 2. False positive. The test says you're sick, but you're not. 3. True negative. The test correctly says you're healthy. 4. False negative. The test says you're healthy, but you're sick. From this table, we can define something intuitive: positive predictive value and negative predictive value. Positive predictive value is the proportion of people who test positive and actually have the disease. Negative predictive value is the proportion of people who test negative and truly do not have the disease. These are easy to understand because they match how we naturally think. If I got a positive result, what are the chances I really have the condition? Now let's talk about sensitivity and specificity, which are slightly different. Sensitivity is the proportion of people with the disease who are correctly identified by the test. Specificity is the proportion of people without the disease who are correctly identified as negative. Here's the catch. There's a trade-off between sensitivity and specificity. By changing the test's cutoff value, the threshold for deciding what's positive, we can adjust how sensitive or specific it is. Lowering the threshold usually increases sensitivity but reduces specificity. Raising it does the opposite. Imagine a slider that moves this cutoff point. As it shifts, the numbers in the 2x2 table change. This is where things get really visual and useful. If we take every possible cutoff point, and for each one, we plot the sensitivity against the false positive rate, which is 1 minus specificity, we get the ROC curve. The x-axis is the false positive rate, 1 specificity. The y-axis is sensitivity, also called true positive rate. A perfect test would shoot straight up to the top left corner and then across. A useless test follows the diagonal. To measure how good a test is overall, we calculate the area under the curve, or AUC. In most real cases, we only have discrete points. So we use numerical methods. Trapezoidal rule. We connect the points and sum the area of trapezoids between them. Rectangular rule, left Riemann sum. We approximate the area under each step as a rectangle, using the height at the left side. The rectangular method is simpler but tends to slightly underestimate the true area. In short, 1. Sensitivity and specificity come from the same 2x2 table. 2. They trade off depending on how we set our decision threshold. 3. The ROC curve captures this trade-off visually. 4. And the AUC gives us a single number to summarize the test's overall ability to distinguish between cases and controls. The interactive tool we introduced in this video is linked in the description, so make sure to check it out and have fun exploring it yourself. If you enjoyed the video, give it a thumbs up, and if you want more hands-on ways to learn stats, subscribe to the channel and hit the bell so you never miss a new drop. Thanks for watching, and remember, don't just think. Feel the stats.